What's up, guys? Welcome to the Celebrity Fight Club podcast. I'm real excited to have this gentleman on today. He's the owner of the Spine, Joint, and Brain Center in Springfield and Wilmington, Delaware. Phenomenal doctor, Dr. Steve Grossinger. How you doing?
Great, Damon. I really appreciate your giving me a chance to talk to your people. I'm looking forward to our conversation. We've known each other for a long time.
Yeah.
I don't know if you recall, I actually took care of you in the 1990s when you were actively fighting. Took care of your dad as well.
Yep.
And it's been great how we've been able to stay in touch over the years. I've been so proud of how you've done such cool stuff.
You too.
On so many fronts, and it's great we've stayed in touch. And it's an exciting time now. I know you're opening up avenues and focusing on pain, which is one of the main areas of my practice.
Well, that's what I want to talk to you about, because it's something, man. Like, I started in boxing. I got into celebrity boxing. Like, it's crazy the phases you go through, because at first you were a doctor. You're into neurology and stuff like that. Now you're into the pain, joints, and how you grew is just amazing. So tell everyone, like, first of all, what made you want to be a doctor in this field?
Well, in general, being a doctor, I was lucky to have a pediatrician who really motivated me. I remember a little incident when I was very young when I was getting a vaccination. And I've always, fortunately, because the approach that this doctor took, and at one point he said, and I may have been like 6 or 8 years old, and he said, this is what the injection is going to feel like. And he actually gave it to me, and like he was pretending that he didn't give it to me the first time,
right.
And then when he did it. But the bottom line was he made it such that it wasn't something that I was afraid of. I know people have had bad experience, whether someone's just not careful enough or uses a big needle or, and it does burn when things go in. But anyway, that planted a seed. Eventually I went on to medical school. I've done all my training in the Philadelphia area.
Sure.
I was at Philadelphia College of Osteopathic Medicine on City Line Avenue, where I went to medical school, finished up there in 1987. I originally did a rotating internship in various areas of medicine, and then a full residency at Presbyterian University of Pennsylvania Medical Center in internal medicine. So I really got to focus on all different areas, from cardiology to gastroenterology, general health problems, intensive care unit stuff as well. And I got to a point in the early 90s when I was finishing my internal medicine. I could have become an internist. I could have gone maybe to become a cardiologist, but neurology was something that caught my attention. I ended up going into practice with my brother.
Yeah.
It actually was an
Big Bruce.
It was an intoxicated decision. The two of us,
we're both there, right?
Yeah, the two of us were at it was a Christmas Eve, and it was a party, and we were kind of drunk and drunker, and trying to decide. We were discussing. His practice was taking off, and he said, why don't you train in neurology, and we'll practice together. We practiced for a number of years. It was good, and now for about a half dozen years, I've had my own practice. It's been kind of nice. So in 1994, I finished. I'd also done a neurology residency, so I became board certified initially in internal medicine, and then neurology. Practiced general neurology until about 2000, and then started focusing on pain. One of the things about neurology, is the evaluation and treatment of problems involving the nervous system, the brain, spinal cord, the nerves, and muscles.
Right.
Often it's you make a diagnosis, and sometimes it's really tough problems like strokes and seizures and tremor, dementia. I've come to focus my practice on pain because I can get more people, out of bed or out of a sofa or up and going. So I evolve different ways. I become board certified in pain management.
Can I ask one thing?
Absolutely.
So when you're saying about, the dementia and stuff like that, so do you basically work into trying to help those different?
Actually, I have chosen to focus in other directions. I do see concussions. A lot of my practice is different kinds of injuries, whether it be it's sports injuries, work injuries, car accidents occasionally. So various different situations. And it may be someone who was just playing with their kids and they hurt their neck or shoulder, or sometimes just as we get older, there can be wear and tear issues.
Hey, I know, man. How many times have you treated me? But I've
been a patient as well, so I think it's good for doctors.
Well, it's a really curious, really interesting on the concussion, because that's a big thing. Like, sort of athletes. So you see all type of people having concussions. What causes a concussion? Obviously, hitting their head, but like, what's it do to the brain?
Right. When there's been trauma to the brain, and there are different types, whether someone's hit by something, or like boxing, or in sports, or if someone has a car accident where they stop abruptly and there's whiplash, and they may not hit their head directly, but it jerks enough that the brain moves within the skull. The skull is like a hard box, and the brain floats within it. So when there's been a sufficient trauma that it impacts the function of the brain, someone may be knocked out, occasionally not knocked out, but typically after a type of head injury, that they may develop headaches, trouble with thinking, dizziness, personality changes, trouble with sleep, various kinds of symptoms that really sometimes will get better, within a week or two, a month or two, but it occasionally could be long lasting. So that is one component where, again, we try to document the extent of injury and then consider treatment options.
No, and that's something, because when, me as a former fighter, and even right now, I'm always mental about, I don't want to get hit in the head, right? So even though I've been hit in the head, but I was, never got hit a lot in boxing. But when you get hit, like, if you have a concussion, how does that hurt you down the road in your life? Like, as you get older, like, is that, if you have a concussion, does that give you a better, like, shot that it's going to end up being, you get dementia or something?
Not necessarily. I mean, if there have been repeated concussions, there can be increased, if you've had a sports concussion as a teenager and then another work-related head injury in your mid-20s or something, it might take a little longer. So having repeated concussions, or being in a sport like football where there's many, lots of head injuries and maybe, or like impacts, may not be enough to knock you out of a game, but it's a cumulative kind of problem. I think there are things that could be done, keeping your general health, your nutrition overall, being mindful of, your diet, your activity level, staying active with exercises helps with blood flow. The brain and other parts of the body depend on proper blood flow. So exercises, and it may be as simple as walking regularly or swimming is great.
Wow.
And of course, weight training and other approaches, are ways to try to, if you've had concussion, I think it maybe reminds you to be more aware of your diet, aware of your activity level. I don't think it's necessarily a formula to ending up with memory problems or dementia. We're learning more and more about that with time.
That's really important.
But again, I think even a problem like Alzheimer's, which is a awful situation, which they're starting to call type 3 diabetes, because it's felt that there are metabolic issues, whether it be nutritionally and different factors. So hopefully, and I think right now, and I know it's maybe controversial, but there really is a focus on making America healthier, with focus on things that are in our foods and medication.
Kennedy's trying to do that.
Right. But yeah. So in general, with concussion, I mean, it is a shock to the system to some degree. Sometimes I'll compare the brain to a map of the United States. And it may be that if you're looking down from a space shuttle, you see the way the United States looks, Florida, typical shape of it. But if you come down closer, there may be some highways, maybe some small towns that have been affected. Like when a concussion occurs, there's parts of the brain that may have had altered blood flow or change in neurochemicals, change in electrical activity in such a way that information going from one point to another, the brain. The outer surface of the brain is where information starts, and then it bounces around underneath and in the deeper parts, and then controls our bodily activities. Doing something like boxing, where you need to have split second reflexes. The integration of that activity, but there could be some roadblocks that the information takes a detour, sometimes gets lost. So issues with memory or coordination may relate to to some problems. Like anything, there is mild, moderate, severe. If someone's been knocked out, if someone has bleeding within the brain when they've had a concussion, skull fracture. Sometimes someone may have a car accident and they may not remember what happened for like half the day leading up to the accident, or they may remember the accident and then wake up in the hospital. those situations do indicate there's been more of an impact. But
Well, how about me? Like I had a boxing career. I have been hit in the head, but I never had a concussion. So is that like?
so it's reassuring.
Like I've
that,
never had a concussion ever, man.
right,
I
so,
never.
So it sounds like you were never knocked out. You never.
I was dropped and I got knocked down once. So but I got up in the sparring.
Sure.
But would that mean I had a concussion if I got like sort of like I was out? I didn't know where I was right away, but then I came back right away.
Sometimes it's momentary, but really the question is how you are in the days after,
Right,
the weeks
right,
after. Right. The CDC has a quote that I think is important that says sometimes the individual themselves, their family, or even their doctors may not be aware that there was a concussion for
Right.
a week or longer. Sometimes you've had an incident, so you lay low. It's probably best to avoid using screens. We're so screen dependent
right,
between
yeah.
computers and our phones. But it may be when you try to get back into the swing of things, you realize that you lose track of things, and that something's been thrown off.
No, I got you. So another thing is like when someone has a concussion, they always say, make sure you don't go to sleep. Why is that?
I think you just want to be sure, particularly if there's been a circumstance where there's bleeding, which could be a progressive thing. It may be overblown to some degree. I think it's just best that someone be supervised. You want to be sure that they don't either become so affected such that that they can't be waking up or.
Sure.
Yeah, but there are various degrees with concussion, which is one component of my practice.
Yeah.
As I mentioned, and our new office, we rebranded our practice to the
It's incredible, man.
Spine, Joint, and Brain Center. A lot of what I do involves back pain, different joints, large joints like shoulders, elbows.
Yeah, when
hips.
I went in there, I was like, oh, man, the people just kept coming in and out. So how has that happened? Because you have grown this practice, man. Like I'm so proud of you. Like going to your office. It's like going into
been gratifying. Fortunately,
it's like it's in Miami, man. It's like nonstop busy. Like you can't to get an appointment with you is unbelievable.
Pain is a growth industry.
How though? Why? Yeah.
I think it's been an evolution. I mean, we've gotten the word out. We have different sources
Sure.
of referrals. Of course, word of mouth is always the best thing.
Right.
But some other treating providers, physical therapists, et cetera, chiropractors.
Well,
may
for
refer
you, how so? Who you are is just phenomenal. Like what you built and stuff. So tell people like what all you do. Like as far as like somebody hurts their arm, my back, you always there to shoot it up. What's the difference between a steroid shot and maybe like a stem cell?
Well, to start out, someone comes in and we need to get a history and physical, find out what happened in general, like what the person's lifestyle's like, their general medical issues, do an evaluation.
Right.
Like I saw your son when he had trouble with his
Yeah,
shoulder,
sure,
Landon,
sure.
great guy, and had a shoulder issue when he was playing football. And, so, you focus on where the complaint is and you want to decide is the examination enough to see,
Gotcha.
is it just a muscular sprain or is there a question of like a tear, like a rotator cuff tear in the shoulder or
right.
ACL or meniscus tear in the knee, different structures. So conducting an examination might direct me to get an X-ray or MRI, or I do ultrasound guided procedures, which is a nice way to pinpoint where we're putting treatment approaches. And one other thing is I have fluoroscopy. I have two
I
offices.
heard it.
in
Wilmington, Delaware, and then on Springfield.
Yeah, right. Not too far from the Springfield Mall on Baltimore Pike. But again, it's first deciding. You have to kind of put information together, and I think my background, even internal medicine, getting a sense for I have to be always on the look out for something worrisome. I sometimes kid. I'll hold my arm up and point it one way or the other and say, "This is my annoying and scary meter." If you strain your shoulder, it may just be annoying. But if you have a wrist drop or weakness in your hand, it may be something that if it's not dealt with appropriately, that things could be worse. Is there an infection? Is there bleeding? Is there cancer even in older or other people? So seeing a person, you have to get an idea, like did symptoms come out of nowhere and gradually get worse and worse? Was it from a clear event? Was it some repetitive activity? Someone may be a secretary who types all day long and develops carpal tunnel and has numbness in their hands. But yeah, so once I identify a problem, then I consider treatment options. And sometimes I guess I used to say 4 main approaches were physical approaches, medication, injection, surgery. I feel like I've evolved since then, but still physical approaches I think are very important.
Sure.
Whether it be physical therapy or chiropractic treatment or just exercise on your own. Medication, I try to minimize medication, but sometimes anti-inflammatory.
Well, I want to ask you that, yeah, because tell everybody what is a steroid shot?
Okay, so then number 3 is injections, and we consider an injection because it's a way to get the medicine right where the problem is. At times, I will use steroids, maybe mixed with lidocaine and anesthetic. Sometimes that's a situation like you've experienced where you do something, you're really uncomfortable, and that may get you right back into the swing of things. So doing that occasionally is, I think can be very helpful over the years, from doing X-ray guided epidural injections where I inject medication into the spine, where the nerve roots are in the disc, versus injecting different spines in the joint. I mean, different joints in the spine, or large joints, as we say, like the shoulders, hips, and knees are our big joints. And sometimes someone has a localized pain in their hand in one spot. We want to be mindful that I will basically say that steroids put out the fire. They reduce inflammation. Sometimes, like the birthday candles, the trick birthday candles, you put out the fire and the fire comes back up.
Right.
I like to consider other options at that point.
Can I say one thing, not to interrupt you, but you gave me Prodipate something. It was some
PRP.
I want to know what PRP is, but remember it was something like it took the inflammation. I take it for 6 or 7 days.
Right. Well, sometimes orally we might give like a dose pack of steroids, prednisone.
Right. It did help. It did help.
Yeah,
that was
again,
why. How's that help? I don't.
Well,
I'm so interested in this stuff.
When there's been trauma, there may be inflammation in the area, and that may reduce it. Again, that may be maybe temporary, or sometimes may knock things out, and you may be fine, from that point. What I was saying before is in a situation we may consider, PRP stands for platelet-rich plasma. We draw your blood like a simple blood test. If you ever had a blood work, we take the blood, we put it in a centrifuge that spins it to concentrate healing factors and platelets. So it's using your own healing factors, but when they are concentrated, platelets are a component. If you scrape your arm, you get a scab.
Sure.
And that's largely made by platelets and other factors coming together to make that kind of crusty thing that eventually evolves and maybe leaves a scar, but maybe not. But platelets they stick together. They can be a building block in trying to heal things. When they open up, they have healing factors within them as well. And then our blood in general, when we use a centrifuge, we increase the concentration of cells. There's probably some stem cell even in the PRP. Stem cells in general is a concept of, we have cells that can differentiate. When you're a baby, many of your cells, may go on to become muscles or heart or kidney, versus, when it comes to treatment approaches, PRP, which is just drawing your own blood, is an option, which we do pretty regularly and can be helpful for pain in your spine, shoulders, elbows, different areas. It has been shown to help when there's a ligament issue. Many high-profile people, athletes, of course.
Sure.
Bryce Harper, may recall his elbow was affected, and
do you use stem cell?
Well, they use PRP.
Well, so let me ask you, not to interrupt you.
Yes.
So when we say stem, you can't promote stem cell. Why is that? And why is it regenerative health?
I think the FDA wants practitioners to be cautious about that.
Gotcha.
But there are cells that can be
another name for it.
Well, basically, there's what's called one thing in abbreviation BMAC, which stands for bone marrow aspirate concentrate.
Wow. This is education to me, man. This is great.
Where basically, typically in your low back, the iliac crest, basically removing some of the bone marrow and processing it, somewhat similar to the way PRP is, but the tissue from there has a higher concentration of the cells. Even though there is the potential to differentiate or change from a cell There are some that can change into all kinds of cells, versus some that are more musculoskeletal. There's mesenchymal stem cells, which are basically felt to be able to change into muscle, ligaments, supportive structures like that. Whereas there are other that can pluripotent, or using big words, but can develop into other things. But realistically, the way it actually probably works is that it really turns on the body's healing factors, locally. When it's in a joint, there can be production of more healthy joint fluid. May help with cartilage, whether it regenerates it, but may just improve, circulation in the areas. But there are various ways that it can try to just improve your healing.
Right.
And there are many athletes, people, of course, I've treated who
Sure.
find that it allows them, they may have been considering surgery, and it may buy them time or sometime alleviate the need for surgery.
So that's basically what it is. Like, say I hurt my back. Say you're an athlete, right? So a Bryce Harper, he has to stay consistent, an athlete. He gets hurt. He comes to see you. What would you, like, if he hurts his arm, shoulder, what do you recommend for him, and how long would that take for him to get back? Like,
sure.
Something like that.
In different scenarios, I mean, it doesn't necessarily work as quickly as, like, the steroid can work, within a day or two, as you've seen, or within a week, whereas the PRP may more typically take 4 to 6 weeks to have its benefit. Occasionally, we will repeat it at 4, 6 weeks, sometimes 3 months. Every situation we try to customize depending on how the person's responding. Often we'll get some physical therapy to try to also augment healing. So there is. We hope that artificial intelligence won't replace us, because we do need to consider different options in our treatment. One thing in approaching pain is what they say, it's biopsychosocial. Biological meaning there may be a specific injury. Psychological,
right.
It may be just the impact, like it knocks you out of work. Social, it may have an impact like on your family, and
sure.
and it's felt a combination, various medical problems. Only focusing on the biological part, or the injury might miss the boat, particularly when things become more chronic. You really have to be mindful, whether it be some
pain messes your mood up. It just messes your mood, messes your life up. I sat in bed.
Even part of the definition of pain is it's an unpleasant feeling that does have an emotional benefit, a component to it. And so as a physician, and I of course try to be compassionate, try to be mindful, try to look at the big picture, and
you're one of the best, man.
I appreciate that, and and consider whether nutritional changes, whether adding vitamins or other supplements. I'm a proponent of B complex and.
Well, let's talk about you real fast. You're doing great. You're my man. I want to talk about you. I get hurt. Why do I want to come see Dr. Steve Grossinger?
Because that I will look at the big picture, look at your circumstance, and customize a treatment option that I have various tricks up my sleeve that I try to keep things as simple as possible.
Sure.
There are times where surgery needs to be considered, and that's I think part of the job of the physician is to see the situation and decide, can you get by with a simpler thing? It may be just ice and compression and rest might be enough. It may be a small little steroid injection. It may be that we have to get an X-ray or MRI or CAT scan to see the extent of injury. So I guess just to know that from my experience, I've been around the block.
Of course.
And sometimes it's a real question of why the pain is there, and it may be that it's pointing to something more concerning, a medical issue. I mean, cancer at times. So we want to make sure that the scenario, that the presenting situation, makes sense, and so. Number one, making sure that something more, sometimes I say you really should go to the emergency room and get hospital level care. We try to avoid and minimize that. Sometimes I might say that we'll get an MRI or X-ray. I may, the day you come in, be able to do something to get you relief. It may be just some simple medication might get you over something and just allow your body to heal. But often I will do X-ray guided procedures. It's nice to know that in our office we have fluoroscopy, we have ultrasound.
That's really great.
I have a new partner that joined me recently.
Yeah,
A great guy, Dr. Bresnahan, James Bresnahan. He trained at Jefferson, did a rehab residency and pain fellowship. Younger guy, a great personality, and has been real nice to take some stuff off my shoulders. Sure. We also have a team, the staff that I've been with. Some staff members I've worked with for over 30 years.
Yeah, I see.
Many have worked with for more than 10 years. So we try to make it a family, kind of feel when you walk in, from our.
Oh, they absolutely is. You have a great practice, I do want to ask you though, like before, I'm going to ask a lot of questions about you real fast, and we're actually going to go over the time, so it don't matter. Regenerative health. Just tell briefly, what is regenerative health?
Well, I guess the idea is to try to improve the healing, and to regenerate. For example, the PRP is one thing that's concentrating your healing factors, trying to strengthen, the joint, whether it be helping where ligaments and tendons attach to bones, the inside of joints are dynamic. There's fluid and cartilage and other factors that it has been shown to help strengthen. Again, nutritional things are important. I mean, there are times, I think being mindful of carbohydrate intake. There are,
awesome.
We could go on and on about particular dietary approaches, but the bottom line is I think we want to look at the big picture, and see it. You may have to modify your activity level, and we may be able to help you along by putting. Whether, and sometimes realistically it is, the regular insurance typically doesn't cover the regenerative treatments at the moment. That may change. So we try to be mindful of.
Do you think with the Trump thing and with this guy, what Kennedy's doing, you think it's
possible?
Help?
Yeah, it'll be interesting to see. I think, even like other people in the administration, are trying to just be sure that there's.
We don't have to get political.
Yeah, I'm just going to say in general, just that there's solid. Yep. Medical. Sometimes you look closely. Headlines can be misleading.
For sure.
Headlines are meant to catch your attention, and not always the whole story. And sometimes when you look at the real data of studies, how they're put together. But again, it's an exciting time because I think there are new approaches that are being done. In our practice, it's exciting that we can offer different options.
Well, with what you do exactly with your options and all, but see, you're a big motivator, and you inspired me to put together this pain relief summit. I don't know, I was going through a lot of pain in the last year and stuff, and just watching you, and I was like, man. I see all these other guys putting these things together, and I'm like, I already have the top guy here, all the other guys. Now everybody's signing, you're going to be a speaker at the first ever pain relief summit, and Ric Flair is going to be photo opping, and just all these celebrities. I got some of the Eagles coming up now. We'll go over it. You're going to be one of the speakers. I'm just so excited. But the pain relief summit, you inspired me in all this. You're inspiring people, I think. With what you do is just so. You just gave me an education. Like maybe that's my next career. But
you hate to be at a point in life where maybe you are more whether it's you're successful or you have grandchildren. I now have a granddaughter is going 9 months who has been life altering. But you want to be able to be involved with your family and just it's not, you don't want to just grow old. You want to stay healthy. You want to stay vital, and it's nice. It's gratifying that I can keep people going. I live in a condominium, and I had heard about a guy who played pickleball all the time, but and was seen by one of the big orthopedic groups, and they said that they were going to do a procedure on him in 6 weeks to help him do an epidural injection. And I said, well, if you come to my office, I can do it next week.
It's awesome. And you're always you help out.
So he's been back on the pickleball court since about 4 weeks after that,
Yeah.
instead of waiting 6 weeks for his first injection. So fortunately, we do have the latitude. I mean, we're kind of small and big at the same time. You know,
Right.
we're not really involved with hospitals. I mean, unfortunately, it's a weird time for hospitals. Crozier
for
Chester
sure,
Medical
for sure.
Center may close today. I mean, they're literally they're.
I hear that. I hear that. Like that's crazy. It was on the news the
yeah.
other day. But see what you do when you shot me up. It totally helped me out. Like I couldn't walk, and you shot me up. I ended up was training the next day in boxing. You know, and it was helped me. But just your whole career has been very interesting. What made you want to be a doctor?
You know, I think I wanted to help people. I feel in a way my mission statement is I like to help people that haven't been helped other ways. You know, I sometimes will see people who've seen, you know, various doctors and tried various approaches, and you know, sometimes the approach has been, I think, too relying on pills, and you know, not to say we have to do, you know. I mean, I think I like to consider options. I like to lay stuff out on the table.
Sure.
You know, say, you know, you could do this or that. Oh, you had an MRI. Let me show you what your MRI explained to you, the significance. And sometimes there's a bunch of things on the MRI that you have to filter through to say, is that part of the problem here? And you know, and there are times where surgery is an option. You know, I try to.
But you don't do surgery.
I do procedures, but I
Yeah.
I don't use knives per se. But there are various things that may be treated with surgery that I can help with the.
And what's your success rate on helping people with their?
I would say it's you know it's pretty high. I would say
Always good.
3/4 of people.
Sure.
You know, sometimes I'll even say like maybe in dividing in thirds. It's like 1/3. You know, can be really, you know, kind of getting it back to your usual
Sure.
self. 1/3 at least it improves things significantly. There may be 1/3 where it doesn't, and then we just have to consider other options. Sometimes it's repeating things, like even, you know, typically like an epidural injection might be done in a series of 3. But I say I'll do 1, 2, or 3 depending on how you respond. I mean, I may do one and it helps one part of your pain,
Sure.
and then consider, you know, a different approach. So I think you want someone who listens to you, and I think
Absolutely.
I pride myself on listening to people.
You
know,
do.
I
have to do
I
that.
put on
You
my
do.
my LinkedIn that I speak medicalese. You know, I mean, whether it be the MRI or, you know, for me to say something that just makes me sound to pump me up. It's more important that you go out, you have an understanding of what's going on.
Yeah, you
and
definitely,
at
you're a
least know what
thorough
your options
guy.
are.
You're definitely a thorough guy. I don't mean to cut you
Yeah,
off, but
no, I
you're a
appreciate
thorough
it.
guy. You
I think
tell it
my,
how it is, and
my background in,
It's just-
you know, as I touched on before, starting in internal medicine, where you have to consider all kinds of options, and frankly, I think my approach to medicine, you know, in some ways, mainstream medicine is finding what pill or, you know, or what surgery. You know, I like that I have other options to put out there for people to keep them going. You know, I try to look at the big picture of you know, how I can improve people's quality of life.
Absolutely.
It's a very
no,
gratifying.
you've done it. You've done it for me too, and you know, I'm a big fan of yours. You know what I mean?
I
And-
appreciate
and-
it, as I am. I
Yeah.
think it's so cool, all the things you've
Yeah.
done. I love following on Facebook to see what's next.
No, absolutely. But with you and all that, so what's your goals like with your practice, and what are you looking to do in the next like few? Say, what's your goal in the next few years, 3 years?
Sure. I think it's to help as many people as possible. It's we are evolving some different approaches for evaluation and treatment. Again, bring on the new doctor, you know, who you know is an exciting part of our practice. He has some, you know, having come out of a pain fellowship in the last you know, a few years, he has some newer techniques. And I think what's great about him is you know, he, like myself, I think he'll talk through the options, and it may be that he suggests something that may be minimally invasive, trying to avoid a significant surgery.
Sure.
But you know, it's to offer a variety of approaches and try to have as many people, you know, up and doing what they need to do. You know, being
Sure.
with their family, doing, you know, if their hobby or their sport, you know, golfing or tennis or
Sure.
pickleball. My wife is.
I want
is
to
a bit
play you in
addicted to
pickleball. Let's
Yeah.
do it. Me versus you in the pickleball.
Yeah.
Come on, man.
Sounds great, and you know, and to you know, have people as we get older. I mean, you want to, you know, be able to stay, you know, live life, enjoy life.
Yeah.
and it's exciting to be able to help people, and some of the feedback I get is very gratifying. It makes it all worthwhile.
Absolutely, and people have to know you are a great guy, and everything you say you're going to do, you do. But just how you built this practice, like watching you grow too, and it's awesome. And
I've been lucky in a way. I mean, now my wife has been very instrumental from the start. She's been the wizard behind the curtain.
Yeah.
She's
So
at home and
how
kind
it
of
works.
overseeing things. And now my son Mark has been with the practice for a couple of years, and he helps just
Your son?
in running. Yeah, my son. So
He's going to be getting into this.
oh, he's he's not a physician, but there are business aspects to run the
Wow,
practice.
this is
He's been
great
with
to
me a
hear,
couple of years.
man.
Yeah, no, it's very exciting. Like
Very
I
exciting.
know how wonderful your relationship is with your son and daughter, and I've been very lucky to have it really be a family practice. I
that
practiced
is
with my brother
awesome.
for years, but and we moved on, and sometimes it's tricky with a sibling. And
Hey, you guys are like me and my brother. My
Yeah,
brother's
but we're-
bare knuckle. I'm sorry, we hit heads, but
yeah, but we're closer than ever, and it's
That's
it's,
awesome.
It's exciting. We do similar things, but just different styles.
no, absolutely, man. And Bruce is a good guy, though. I remember if it wasn't for him, I wouldn't have pulled off the Jose Canseco versus Vicek Hema fight. He came in last minute, helped me out, and the athletic commission let it go. But yeah, you're part of a family. Now, was your mom or dad or anybody in the medical field?
No, my mom, I kid, she kind of gave us a choice. It could be a doctor or a lawyer. My other brother is a lawyer who incidentally works with NFL concussion cases and other kind of.
Does he sing
athletes.
you? Does he sing you people?
Occasionally, yes.
Doug, you better.
But I've been very lucky.
Are you into that though, the NFL? Because they're really big on the concussion now.
Again, I'm more. I think I rather help or realistically, I work the guy down the street and in the area, and fortunately, people will come out of come a distance to see me because they get good recommendations. But so I the people who are watching this, I know you have a variety, but I'm more than happy to give an opinion to see if I can help, see if my partner
Well, absolutely,
can help.
because listen, Dr. Steve Grossinger, people have to understand, everybody's in pain, and they have to go, where am I going to go? Go see Dr. Steve Grossinger, Springfield, Delaware, just go see him online. I mean, you're one of the best, man. You are. You're
I
the
really
best.
appreciate it.
But yeah, they got to come see you, and because everybody's injured. Like I don't know what it is, or if either
Pain is a growth industry. Luckily.
It's great.
But,
It's
but
just-
realistically, it's I think part of
It is.
growing over time. I mean, you get to my age, I feel like I'm in the pain of the month club at times. What's one thing or
Do you
another thing,
suffer from back injuries and stuff too?
I went
think
through
you
a
said
series of
earlier.
epidural injections last
Yeah.
year. One of my former associates was nice enough to come in the office, make a house call to my office. But I think it helps that I've had pain too. I think I think the aggravations of the medical system, getting MRIs done, getting prescriptions. I was going to get a prescription from a doctor who I see, and they needed an authorization, and he said to me, it's too much of a hassle to go to the authorization. Go to goodrx.com where they give you better prices. But the system is is really tough right now. I'm fortunate that we have somewhat of a freestanding situation. We're not really dependent on hospitals or other things.
Right.
If someone needs to get in, typically we can get them in in a timely fashion. It's
It's a
become
business
crazy.
too, you know what I mean? Like, but the truth is, like, listen, and I don't want to ever cut you off, but the truth, people have to know this. As people, everybody's in pain, right? So everybody, and they'll pay anything to get their injury fixed if they needed to, and they have to. It's crazy.
Pain sucks, and
It's
that
crazy.
sounds like an abrupt thing to say, but when you're in pain, then you know it. It's just. Again, it's you want to be doing something and it slows you down. I mean, it's really it can be depressing and frustrating, and so we try to reduce or knock out pain best we can, and fortunately we've been pretty successful.
No, awesome, definitely, and that's why I'm really putting this pain relief summit together. I don't know, nobody's really done anything like this really, so I have something interesting because bringing Ric Flair in to be a photo op, some Eagles, and having you part of it. And briefly, because I don't want everyone to know, because we're going to show these clips, give everyone a little bit understanding what you're going to let people know on June 14th.
I think at that time we'll pick a couple topics or something to maybe give a deeper insight into.
Sure.
I think you'd like to have some understanding of the why we consider doing different approaches. I think it's great that you'll be bringing people together because pain presents in so many ways, affects, there are some situations where people have pain from head to toe, unfortunately, or sometimes just one part of their body. There may be a medical issue, may have arthritis. I mean, I have patients, actually my mother is 89 years old and fortunately I've been able to treat her, and been gratifying to keep her going. And, so, I think it'll be interesting to see what other people will talk about because like anyone, they have their niches and their
You're a highlight. We're going to highlight you because you're my man. You know that. I'm excited to have you, man. Really, I am.
Yeah.
And this is like all overdue anyway because you deserve your flowers and you deserve
I appreciate
the respect,
that.
man. You're the best, one of the best out there. And I'm excited to have you, but just tell everyone what's next for Dr. Steve Grossinger.
Yeah, I think it's trying to grow our practice to offer more services. Fortunately, we have a great team of assistants I work with, and at the moment we're growing to fill the space that we now have with Dr. Bresnahan, who's a great guy, happens to be a scratch golfer.
Oh wow!
Really,
I got to golf
really
with you
well
guys sometime.
Yeah, I'm far from a scratch golfer, but it is fun. But the bottom line is I think we want to evolve into different areas, whether it's working. We will work with different physical therapists and chiropractors and other providers, acupuncturists. We try to give different options. There's no one size fits all.
Sure.
Sometimes a spine injection may be helpful. Sometimes using ultrasound, which is an exciting thing because it really allows pinpointing treatment. And it may be that the MRI indicates something, but then under ultrasound, when the person's moving, you see that there's a dynamic or a moving issue that then can be pinpointed and helped out.
Absolutely. So before we go, just tell everyone, give everyone all your services you offer.
Sure. Yes, we do nerve testing. I do EMG and nerve conduction studies, which can help to pinpoint, is there a pinched nerve in your neck, your back, your arms, your legs. I have fluoroscopy or X-ray guidance. Sometimes you have to go to a surgeon. We actually are we are certified as a treatment facility, and it allows us to do things right in the office.
Sure.
Often today, it can take months, to even get in for an evaluation. And at this point, fortunately, particularly when if something is more urgent, we can get people in, sooner.
So you're that backed up.
Well,
wow.
There's a lot of people in pain,
awesome,
but we again, with our team approach, we try to
awesome.
see people, and when you're there, we try to give personal attention.
Yeah.
Again, I think we have a menu of things to offer from whether it be steroids, whether it be PRP and stem cell type procedures. We do get some tissue that's umbilical derived tissue that can be used as a treatment approach as well. So. And again, Jamie has even a longer list of approaches
awesome.
for back pain and joint pain. So we likely will increase the size of the practice, whether possibly getting a orthopedic specialist involved. But again, we're taking one step at a time. I mean, we're grateful to have the chance to help people out.
Sure.
Fortunately, have a team that I think. If you see my reviews, which I appreciate.
Yeah, where, Doctor, what's your website?
Well, if you go under drstevengrossinger.com, Dr. Steven Grossinger, the new practice, sjbcenter.com also takes you to our website. But, I guess if you search Dr. Steven Grossinger.
Yeah, well, you'll just go to Celebrity Box. I'll be posting all over anyway, so.
Appreciate it. I really, our friendship over the years has been wonderful. Friends helping friends makes the world go round, and I appreciate this opportunity. And
definitely, I want people to come see you because when they're in pain, they don't have to suffer. If you're in pain, go see Dr. Steve Grossinger because you're definitely going to take the right approach to help them. You've helped me, so I know that.
Yep, that's been
thanks,
great. I
man.
really appreciate helping me.
Well, I appreciate
get
you
the word
being
out.
on today, man.
My
You know,
pleasure. I
we're
enjoyed.
excited to have you speak at the first ever Celebrity Boxing Pain Relief Summit on June 14th. It's gonna be very interesting. And Dr. Steve Grossinger on Celebrity Fight Club podcast. See you next time.